to talk more about ways we can flatten the COVID-19 curve. Joining us via Skype from Imo State is Professor Chinyeru Kaga, National President of the Parasitology and Public Health Society of Nigeria. Thank you for joining us on the program.
Thank you very much.
First, what's your assessment of the fight against COVID-19? Are we winning the war against the pandemic?
At the moment, I think I would like to talk about our efforts, the effort of the society in winning this war, because it's a collective effort. Our society is the Parasitology and Public Health Society of Nigeria. We were established in 1973. And we're made up of a network of lecturers and researchers, health practitioners and graduate students from universities, research institutes and ministries. Our mandate is to develop training and capacity, which responds to the research and service needs in the country, and that brings in the COVID. For some time, we observed the situation in Nigeria, and then we noticed some operational challenges which needed to be addressed so that we can really flatten the curve of COVID-19 in Nigeria. Some of these operational challenges we noticed we have transmitted to the NCDC and the Federal Ministry of Health, and these include to really understand the pattern of COVID transmission at the community level. There is no doubt that we have a community transmission of COVID-19, and every day we are giving updates on the numbers positive. We are researchers. We need to understand the pattern of transmission so that we can know where to come in and block it. Another operational challenge we have noticed is the need to improve prompt diagnosis and isolation of cases. We are yet to identify in Nigeria the COVID-19 specific symptoms. Do we have location-specific symptoms? Are we experiencing the same symptoms the Europeans and Americans are experiencing? Is there a relationship between malaria symptoms and the COVID-19 symptoms? These are questions that need to be addressed. The third operational challenge we noticed and reported were investments in advocacy at the community level. The television is filled with adverts on what to do to stay safe. We have text messages coming to our phones. We also have the social media with information. But at the community level, there are limited efforts and investments in advocacy, sensitization, and mobilization strategies at the community level. And this is where the transmission is ongoing. My society, the Parasitology and Public Health Society of Nigeria, decided to play a role in community mobilization and awareness campaign through flyers and posters in the local languages across the countries. We have about 600 members registered in our society, and we got our members in the different states to play roles in participating in local meetings where they spread the message of keeping safe and distributing the flyers. And then we also, because we're academics and we're researchers, we have designed a study, and we're in the field doing situational analysis on 3 prongs. We're exploring participants' opinion on overlapping symptoms and accurate recognition of the COVID-19 disease. We're looking at assessing the community management of COVID-19 and malaria. And we're exploring the key barriers, challenges, and solutions to prompt COVID-19 lab testing. We are almost through in the field, and we will start analyzing our findings by next week. Our findings will be made available to the federal government, to the NCDC, to help flatten the curve completely. We'll know where we're going wrong and what we need to do. Thank you.
We'd like to thank you so much, Professor Chinyeru Kaga, National President of Parasitology and Public Health Society for Nigeria. Thank you for joining us on the program with that update. We have more on the global response to the pandemic when we return. Please stay with us.